Paul. How are you, sir?
Fine, thank you, sir.
Mr. Paul, thank you very much for creating time to join us for this conversation. As you well know, Lucas Media aims to educate the public on a number of areas of interest, but primarily on matters to do with health, matters to do with family, matters to do with the community. So we are very, very delighted to have you on board. So once again, thank you so much for creating time to join us for this conversation. So
You're most welcome.
thank you very much, Mr. Paul. So perhaps to set us off, you can begin by introducing yourself and the role that you play, or the role that you played, Mwalimu Paul.
Paul Ochele by name.
Mm-hmm.
I'm a medical laboratory technologist.
Okay.
With vast experience in medical research.
Mm-hmm.
Having worked with the Kenya Medical Research Institute
Mm-hmm.
and various of our affiliates in Kisumu.
Mm-hmm.
Yes.
Mm-hmm. So that was how long were you able to engage with them, Bwana Paul?
I started working with Kenya Medical Research and affiliates in 2002, towards the end of it, until 2011. That is end of 2011. Yes.
Okay.
Yes.
So, Bwana Paul, thank you so much for the introduction. One other thing that caught my interest is the organization known as the Centers for Disease Control.
Yes.
Did you perhaps have an opportunity to engage with the Centers for Disease Control in one way or the other?
Yes. I worked with the CDC for CDC Cambridge from 2009 to 2011. In a project called NTD, that is neglected tropical diseases, on schistosomiasis and malaria. Yes.
Talking of CDC, Mwalimu Paul, my understanding is that CDC, there are two American organizations that deal with matters to do with health that have been helping Kenyans for very long. We have CDC and then we have Walter Reed.
Yes.
What is the difference between the two organizations?
Both are American entities. Walter Reed is basically a U.S. military project. That is, it is currently called USAMRO. It used to be Walter Reed.
Currently called?
It used to be called WRP. Named after an American militant.
Yes.
Who was also a medical researcher. Who resorted to bringing some medical aspect of the program to Kenya to research on matters malaria. That is when malaria endemicity was so high on the lakeshore region of our country. That is in Lake Victoria shoreline and along the Indian Ocean at the coastal regions. Yes.
Okay.
Yes.
So
Walter Reed was the founder of the U.S. Army military project in Kenya. So he affiliated to Cambridge, which is the mother research body in Kenya. Now it's currently called USAMRU, that is U.S. Military Research Unit.
U.S. Military Research Unit.
US military
So it's called USAMRU.
USAMRU. Currently it is called USAMRU. Yes.
But it's still operational, I hope. Same to CDC.
Yeah, same to
and
CDC.
If we talk of CDC, do we have in Kenya, do we have CDC Kenya? Do we have CDC East Africa? Do we have CDC Africa? How is CDC divided? Especially, I'm asking this question so that there are students or people hoping to join the health fraternity to help them in preparing well for their academic courses, academic journey. So is CDC divided into components?
Well, CDC has various mandates, and so depending on the mandates, there would be some studies affecting a particular region. Like if you come to Kenya, we have CDC headquartered in Nairobi. So that is at the Cambridge headquarters in Kenya. That is at Ngumo. And we have CDC Kisumu, which is actually affecting the let me talk of Lake Basin region.
Yes.
That is affecting Kisii, Kilgoris, Migori, Kisumu, Homa Bay, the Kano Plains,
okay.
Theme regions, Asembo, Bondo, Rarieda constituency, and parts of Kakamega and Vega counties.
Okay.
Now we also have CDC in other regions, because actually it is actually spiraling at the moment.
Okay.
It's actually growing. It is unlike the way it used to be. Yeah, when I worked with it, it had not actually expanded to cover or to affect the regions that it is covering today.
Okay.
So region CDC is growing at the moment. Yeah, that is what I can say.
Okay.
Yes.
And Mr. Paul, talking of community health challenges, from your experience, what are some of the biggest health challenges ordinary families in Kisumu and across Kenya face today, and why do they persist?
This is an interesting question, but let me try to answer it.
Okay.
By saying this, the challenge that many families face today, or I mean have been facing even in the past, in matters health, according to me, one is lack of information.
Okay.
You realize that depending on the region, our level of information, that is the level of information that that the locals already have or have armed themselves with concerning a particular disease or particular diseases is limited. Okay. And this actually affects the disease pattern. Okay. That is why you'll realize that when you come to the shoreline or when you go to the shoreline of Lake Victoria, you'll realize that there are so many families that are actually suffering of disease conditions that could have been managed. Yes. And some of them have actually lost their lives as a result of lack of information. Okay. One, they have not been sensitized on how to prevent these diseases, and therefore they contract the diseases and they are not able to manage them because two, my second point now is finances. Okay. That is financial ability of the people around these places. Okay. You realize that one has contracted an infection or a disease condition that could be managed, but because one is not able to raise funds towards treatment, he or she is incapacitated. Okay. Yes. Okay. Then another point is policies. You realize that policy execution is actually wanting. We may have very good, very profound policies having been designed by the government, but then when it comes to executing what the policy is actually demanding, it becomes a problem. Okay. Perhaps because of corruption. Okay. So those are the major problems that our families are facing, that's incapacitating them.
Which are some of the most prevailing diseases in the region, and perhaps by extent to Kenya, just by name, common diseases that come to mind?
One of the killer diseases that I would talk of in Kenya generally is malaria. Yes. Two, HIV and HIV-related diseases. Okay. That is some of these opportunistic infections for them that already have HIV. Yeah. And we also have I would talk of the STIs, the sexually transmitted infections. And the sexually transmitted infections are as a result of the same causes that I mentioned before. Okay. People wanting to raise money for a living, and therefore they end up being promiscuous. For cheap sex, they want to sell their bodies, so that they can raise money to be able to fend for the living. Now we also have conditions like typhoid, where hygiene is an issue, because you realize that most of our settings in Kenya are slums.
Yes.
So majority of Kenyans are actually settled in slum areas, and that is actually affecting them in matters hygiene. Yes.
And talking of policy, Mwalimu Paul, a policy brief by the National Council for Population and Development, that is NCPD, which is also apparently a policy brief of 2018, as well as UNAIDS, that is the United Nations agency that deals with issues around HIV and AIDS. Why are Gen Zs predominantly leading when it comes to new cases of HIV infections in Kenya, say compared to millennials who are their older brothers and sisters? Why do you think there's a surge, there's a very high increase in new HIV infections among Gen Zs in Kenya?
I think one of the major reasons as to why Gen Zs are suffering this surge or recording higher numbers when it comes to HIV prevalence in Kenya today as compared to the older generations is because of one. This is a lot of people that are not able to listen to advice, and so many of whom are affected by the modern technologies which actually influence them socially, and they end up like succumbing to some of the conditions that they could have prevented or they could have ignored. A Gen Z today would hardly listen to an older person, so they influence. They influence among themselves. They influence themselves at their level, and that is why you will realize that most of the things that affect them are actually common and cutting across their age group or their age set. Now you realize that when a Gen Z is told of an event, he or she will embrace the event without questioning. That is one. Two, you will realize that this particular person, having attended the event, which perhaps might not have been pre-planned, may end up actually engaging himself or herself in unwanted sex or in unprotected sex. And when that happens, under the influence of drugs, they end up contracting infections. Another reason is the fact that the Gen Zs, most of whom, especially the ladies, are not interested in conceiving.
So they're not interested in having children, basically.
They're not interested in having children. They're not interested in marriage. So the same happens to the male Gen Zs who are not interested in marriage.
Yes.
But again, they are not interested in having children. But they are interested in having sex with the young ladies of their age. Now you realize that when they are not interested in having children or raising families or starting families, one thing that is inevitable among them is the fact that they would want to enjoy the pleasure of having sex, and they end up like having that sex unprotectedly. So chances of them contracting HIV definitely is raised through that. Now another thing is the fact that the young ladies who are in that age bracket of the Gen Zs are interested in making money. Now they would want to make money, and some of whom would subject themselves to sleeping with older people or having sex with older people who infect them.
Yes.
And they end up infecting the younger males of their age.
So basically it's a matter of older people, older men or older women infecting them, and then they too end up infecting their age mates.
Yes.
So the issue of protection comes into fore.
Yeah.
They need to use protection whenever they engage in they intend to engage in
how I wish they could use protection.
Yes.
And if not,
yes,
they could abstain
completely.
Yes.
To act. So basically, practicing the ABC of sex come into place.
Yeah.
The ABC of sex.
That will be most important.
Okay.
If they could do it.
Okay.
Yes.
Mwalimu Paul, talking of lifestyle and urbanization, as towns like Kisumu, Nairobi, and Nakuru continue to grow, we have lifestyle diseases like diabetes, hypertension. We see them increasing in levels. How do we balance between modern living and healthy lifestyles that our grandparents, for example, practiced?
It might be very challenging, depending on the pressure of life today.
Okay.
It might be very challenging for us to find that balance.
Okay.
Because things have actually since changed.
Yes.
And that is to say, we may not be able to locate for ourselves some of the food that we used to have or we used to enjoy in the old days.
Okay.
Some of the food that we used to have in our cultures were not necessarily to be cooked with cooking oil, or fat and all that. But now you see, things have since changed.
Yes.
Most of the food that we would want to prepare demand that we use cooking oil.
Okay.
There's raising cholesterol levels in our body.
And
such things.
Yes.
So we used to have some manner of porridge or some other food that did not necessarily need sugar. But today we would want to use sugar and such things to sweeten our food. We would want to use salt in food to make it sweeter. Some of our veggies did not necessarily have to be applied for salt to taste sweeter, or to be acceptably edible. Now lifestyle has since changed, and that may definitely affect some of that. Apart from that, there are issues to do with some of the chemicals that are used in production of the same food. So a lot of science come into play. Yes.
Okay. Thank you so much, Mwalimu Paul. Thank you very much, Mwalimu Paul. Mwalimu Paul, in terms of public trust in health institutions, because you'll come to agree with me that not many Kenyans have serious trust when it comes to public institutions. Many Kenyans feel mistrust towards public health initiatives or institutions due to corruption or poor services.
Yes.
How can, as a person with vast experience in the medical practice field, how can health professionals rebuild that trust with the ordinary wananchi?
Let me say, building trust will depend on our local devolved governments.
Okay.
In the first place, because we currently have smaller institutions affecting health matters.
Yes.
We have the level 3 of the government institutions that are actually carrying out some of the government policies at grassroots levels. I think the most important thing that should first of all be done to restore that confidence is the community health workers ensuring that they collect appropriate data.
Now they're called community health practitioners. They used to be called community health volunteers, but now they're community health practitioners. Okay.
Now, I believe they are well equipped today.
Yes.
They have all that it takes to help the government gather enough information concerning our population. Now, at grassroots levels, they could collect, if they could discharge that responsibility of collecting appropriate data and then conveying that appropriate data to the relevant authorities.
Yes.
And then the relevant authorities ensure that whatever the information that the community health practitioners gathered on their behalf is actually made proper use of.
Okay.
These particular people interact on daily basis with the locals.
Yes,
with the local
mwananchi,
with this patient on the ground.
Yes.
And he or she may therefore know what these households suffer.
Okay.
Like there could be a mama somewhere who is ailing. She has HIV. She's not able to feed well. Maybe she has conceived, but then she's not able to carry out herself in matters health. She's not able to access some of the government health facilities.
Okay.
Based on maybe distance and such like things, and other incapacities. Now, when the government could be able to listen to this kind of information, I think we could be in a position to restore confidence. That is one. Two, we could be able to restore our confidence among the Kenyan person who is perhaps feeling sick and would want to be attended to, but is fearing that he or she would go to a particular facility but still come back without being attended to. Only when they could be attending these facilities and they find that they are not charged for registration, they are not charged for laboratory and for these other tests, only to realize that some of the drugs that they would have been given are not in the facility. So if all these institutions could work in sincerity or in honesty, I think that restoration of confidence could be achieved.
Thank you very much, Mwalimu Paul. We are learning so much on matters to do with people's health and health generally in Kenya. We really want to thank you very much for the insights you're sharing with us today here at Lucas Media. Now, Mwalimu Paul, before I let you go, as we conclude on matters health affecting Kenyans as a whole and perhaps other people in other parts of the world, talking of the public health and culture, we realize that in some areas, traditional beliefs continue to clash with modern medicine. How can health workers respectfully work with culture and traditions without dismissing them, but still save lives? Because you realize that education also comes with its own set of challenges, and most health workers are very highly qualified persons. So how can they marry traditional beliefs, some good traditional beliefs, with modern medicine in order to be more productive and meaningful in as far as public health and culture is concerned?
I think both the culture and the modern health or modern medicine are important. And culturally, you will realize that some of the parameters that were put in place were actually helping these particular people within the regions to perhaps keep their health well. Like if you talk of a culture like low culture, you will realize that some of the things that we will actually want not to do could perhaps be things that were feared to cause us harm. Now, if only we could embrace our cultures based on the good things that the cultures have, and then we relate them to modern health based on what modern health teaches concerning that particular aspect that the culture also has its way of teaching or our way of teaching, then I think we could have a solution. And I'm actually not so able to understand what you meant, but I would assume that you perhaps meant culture
and modern medicine.
You know,
and modern medicine.
Perhaps you could, or we could, perhaps contrast between modern medicine and herbal.
Yes.
Or alternative medicine.
No, not necessarily. Just a matter of cultural practices and then embracing modern medicine. Yes. Because you find that there are some cultures that are averse to modern medicine.
Yes.
So a matter of bringing them together so that the person in question who needs assistance is assisted well.
Yeah.
Be it a patient or be it somebody under medical care or something like that is assisted well.
Yeah. That makes a lot of sense.
Yes.
Because our cultures, some of our cultures actually hinder us from accessing modern health. Yeah, because of the interpretation.
And would you say that culture is a bad thing when it comes to modern medicine?
It becomes very challenging because much as it is not a bad thing, some cultures would not embrace modern medicine.
Yes.
A good example is the Maasai culture.
Yes.
Where one would want to, take some concoction to cure a condition that perhaps is diagnosed and is known to be lethal.
Yes.
Perhaps the condition is acute.
Yes.
And you fear that if this person is allowed to administer those concoctions, then the person may lose his life.
Correct.
Now, culture may be demanding that that person be kept. Perhaps in seclusion or in isolation for a particular period of time based on their understanding. Because, when cultures were actually being crafted, there were very poor levels of information.
Correct.
And now, if you want to marry the two, then it becomes very hard because someone believes that a particular disease can only be contained or managed in such a manner, culturally. But now, when it comes to modern medicine, you are able to diagnose and to find out which particular disease this is. Now, if you realize it is a disease that should be managed by giving injections or by administering oral drugs, medicine, then you realize that the person in charge of taking care of that patient may not perhaps allow you to administer treatment on the person based on their culture. So those are the challenges. So it becomes very hard marrying the two. But we appreciate both. Yes.
Thank you, Mr Paul. And I believe there are also certain medicines from traditional practices that are also working, if I'm not mistaken. Herbal medicines, so to say. From your experience, do they work? Do herbal medicines work?
Herbal medicine work, and that is why they are called alternative medicine. They are alternative to the modern medicine, and that is why even currently in the Kemri that I mentioned, we already have laboratories for herbal medicine, and that is to say we embrace herbal medicine as part of treatment. Yes.
So it's something that is medical professionals and medical practitioners have accepted and taken on board.
We have
to some extent.
We have people who are training in herbal medicine, and it is acceptable. It's a discipline that is in existence. It's a discipline that is acceptable.
And because many Kenyans may still have a lot of faith in herbal when it comes to herbal medicine, are these people, herbal medical practitioners, are they trained? How do they then go about even administering in terms of prescription of the herbal medicine?
The herbal medicine that I was talking of to be effective and to be acceptable, in my view, is not the kind of herbal medicine that traditionalists dispense.
So there's a difference between traditionalists and herbal medical practitioners.
The alternative medicine that I was referring to in this context is the kind of medicine that is well researched on. That would now come out. Come up with dosages. Even if it is herbal, it is generated from the herbs.
Yes.
But then it can be given in dosages.
Okay.
For a particular condition.
Okay.
But that is now opposed to the traditional medicine that was actually dispensed or administered without dosages.
Okay.
Non-dosages.
Okay.
Now, the herbal medicine that I would refer to in this case is that which is alternative to modern medicine, and most of whom or most of which are enzyme based.
Okay.
You know, the difference now in this case comes in where if you look at the composition of the modern medicine, then they are chemically formulated. Okay. And when you talk of the herbal medicine, they are enzyme based.
Okay.
So when you talk of them, then we are talking of something that is alternative to modern medicine. But you may find that where the modern medicine is not able to clear a particular infection based on its incapacity in terms of which particular cell, tissue or organ of the body is it able to reach. Then the herbal medicine may be having the ability to go to the bottom of the organism. That is the smallest unit of the organism, and that is the cell. Now, most of the modern medicine, according to my knowledge, are targeting the tissue. Now, the alternative medicine in this case are targeting the cell. Now, because they are cellular, they end up, detoxifying the cell. Then they turn into, they detoxify the cell. That is, they get rid of the toxins within the cell. Then, having done that, they turn into food for the cell. When they turn into food for the cell, you realize that the cell gets rejuvenated, and the whole cell gets replenished. Now, when that's one cell is replenished, another gets replenished, and the third one, and so on and so forth. Then you realize that all tissue becomes healthy. It regains its health. Now, when tissues regain their health, then an organ regains its health. Then like organ system now gets back itself, and apart from the organ system, now we have the whole organism. Now, those are some of the beauties of the alternative medicine, the modern herbal medicine, or what currently are put as supplements and supplements, as opposed to modern medicine.
So they're also used as supplements, if I may.
They are used as supplements.
Mwalimu Paul, because time is really not on our side, we have 30 minutes for this section. And the information we are getting is quite interesting. Now, as we conclude on the health segment for today, in terms of the future of health science in Kenya, as someone who has worked in global health, what advice would you give to students who are pursuing health science or any other health-related courses in their health journey, so that they can continue keeping the field of health more steady, as well as the call of action for Kenyans? What advice would you give to those students pursuing health-related courses in Kenya?
What I can say is that health is a good thing to research on, or to study, and I will only challenge them to continue, researching more and more on what will be good, not only for their studies, not only for purposes of enabling them to get their certificates or to attain their degrees and such like things, but for purposes of for purposes of helping our big and growing population to be able to have knowledge that is commensurate to be able to prevent some of these disease conditions. It is better to prevent than to cure. To our government and to policymakers, other policymakers, is that let's be proactive towards up with that will help our population to be able to execute some of these populations, you know, with clarity, because we already know what is good for us.
Okay.
Yes.
Okay. Well, Paul, as we conclude, if there's one thing you could tell Kenyans about taking charge of their health today, something practical they can do at home or in their communities, what would that be?
What I can tell Kenyans when it comes to social life,
yes,
and health,
yes,
I would talk of you know, abstain from sex.
Okay.
If you can.
Okay.
If you're not married,
okay,
abstain from sex. And if you're married, stick to your partner.
Okay.
Then
Be faithful. That is the ABC of sex. One is abstinence.
That is it.
B is be faithful.
Be faithful. That is the key word. Now, when it comes to lifestyle conditions,
Okay.
Which are actually a bigger issue today, let us you know, embrace you know, some old food that may not taste sweet. They may not taste so nice.
Yes.
You know,
like which foods, for example?
Like the vegetables.
Okay.
Let us be used to vegetables. You know, take a lot of vegetables. Let us, you know, reduce on carbohydrates and proteins, and then embrace a lot of, you know, vitamins. Then we will be able to keep some of these disease conditions at bay. Apart from that, let us shun junk. These junk foods.
And that's what we're talking about, chips. So will people leave chips?
If you have to take them, then you may have to reduce, you know, the quantity.
Yes. Consume
them, but controllably. Consume them, but controllably. I think that is my point. Yes.
Mwalimu Paul, thank you so much for your lovely and wonderful insights. I think Kenyans will be more informed after watching this particular episode on matters pertaining to their health, in order for them to be able to lead more healthy lives in the coming days. And we really want to thank you so much because for creating time to join us for this conversation. I think we look forward to more engagements with you as we continue to enlighten Kenyans on matters to do with public health, matters to do with their own health, matters to do with community health, and matters to do with the national health. So once again, thank you very much, Paul, for your wonderful insights.
You're welcome, sir.
Thank you very much, sir.
You're welcome.
Thank you very much
for your time.
Okay.
Thank you for inviting me.
Okay.
Yes.
Okay.